So I'm a newborn ICU specialist, and I have to say, my experience in the newborn ICU has been quite different. Thankfully, COVID seems to be a disease that does not affect newborns too much. Maybe it's differences in their physiology, the receptors they have in them, but we've seen a lot of mothers come in with both asymptomatic COVID infection picked up on COVID screening tests, as well as symptomatic COVID infection. We're a high risk delivery unit. Um, but and we've tested babies of all of these mothers, and actually at our local institution we have had very few to nil cases of positive babies. Across the country, there is actually a perinatal COVID registry which has been tracking mother baby dyads across the US, and I believe the UK also has a similar registry. And what they've seen is kind of similar. It's pretty uncommon for the babies to get an infection, even if the mom has an infection. I think they're quoting rates less than 2% of babies getting infection. And when they get infection, for the most part, again, babies do not seem to get very sick. They can get a fever, they can get less active, they may have breathing symptoms, or not feed well, or have vomiting or diarrhea. But for the most part, they do well. The higher risk categories for babies are premature babies, and also again, babies with underlying medical conditions, say heart problems or other congenital problems. But for the most part, thankfully, babies do seem to be somehow able to not acquire the infection, even if the mother is suffering from the infection. I'm curious to hear from Dr. Rakshay if if he has any insights on newborns in India, and whether what I said about newborn rates of COVID being low in the US, whether that seems to be holding true in India as well. I'd love your thoughts on that, Dr. Rakshay.
Yeah, thanks, Lakshmi. And I think the experience has been very similar here too. This time around, there are a lot of pregnant women who got infected, but thankfully, like what you mentioned, the newborn infection did happen, but it did not seem to happen in a much higher rate. And those who got infected too, many of them, of course, there are some case reports of some children becoming seriously unwell, but they are far and few in between. But I think the message to the public is majority of them do quite well, thankfully in children.
It says, today I saw a report in media of a 20-day neonate who was COVID positive. How common is it? How to manage?
Yeah, thank you for that question, Dr. Raj. So we do see occasional reports of young neonates getting infection. And as I mentioned earlier in the talk, we think the mechanism of getting the infection is typically from someone who's infected around them, either an older child or adult who has the COVID infection and is transmitting it via droplets or as aerosol to the neonate. But again, it is as I mentioned earlier, it is quite rare for young babies to get the infection, but it's not impossible. And they can have a range of symptoms. A lot of the time, thankfully, it's mild illness. But again, given the age of the child, less than a month old, this is important to be in regular communication with your pediatrician to ensure that you're giving the baby the right supportive care. So, just like any viral disease, management of fever, keeping the baby hydrated, supportive care, watching their breathing, making sure that they are not in distress with their breathing, making sure they're not vomiting so much that they're getting dehydrated. These are all the supportive care measures that are needed. And again, if you're worried, having the baby seen by the pediatrician to decide whether admission to the hospital is needed is going to be important. But every case is going to need individualized attention to decide whether home care is appropriate, or whether the baby should be admitted and management done in the hospital. But the treatment primarily is going to be supportive care, keeping the baby hydrated, and if the baby needs respiratory support, giving oxygen and things like that are going to be the management needs. The need for a ventilator is probably very unlikely, but again, we've seen some occasional cases of babies needing ventilators, especially if they have other underlying medical conditions, or if they are premature. Yeah.
So, can newborns get COVID-19? Dr. Lakshmi, I think you might have already touched this, but if you want to briefly say something.
Yeah, I'll take the newborn question very briefly. And to summarize, the answer is yes, newborns could potentially get COVID, but the risk of transmission seems extremely low. It doesn't seem to happen during the pregnancy or even during the delivery. It seems to be after birth by transmission through aerosols and droplets from the adults to the newborns. But again, the risk is very low, and newborns typically don't get very sick from COVID unless they have other risk factors related to prematurity or other diagnoses, other medical conditions that the newborn has. So, bottom line, very low risk. It's not impossible, but it seems like it's a fairly low risk for newborns to get COVID-19. And adults around them, if they have the infection, should mask, should distance, I mean, not distance, but should do hand hygiene. And if they're feeling ill, should try to maintain space from the baby.
Okay.